So my name's Antoinette Anazodo. I'm a Paediatric and Adolescent Oncologist and the Director of the Sydney Youth Cancer Service. So I work across Sydney Children's, Prince of Wales and the University of New South Wales. The government's response is to ensure that cancer patients are kept well, and in doing that, the general advice to everyone at the moment is to stay indoors unless they have to go outside. What we are saying to cancer patients is that the cancer patient and their carer or carers should remain inside the house as much as possible. And that's to ensure that there is no community contact with someone who may be COVID-19 positive. Now, in reality, that can be really difficult, especially if you live on your own or your carer has to work. So I think the things that we really feel are important is that the patient shouldn't be working or going to school, because that will increase their risk. You're not allowed to eat out in restaurants anyway, but when you are buying food or takeaway, making sure that the places that you are going into are clean and have good standards of hygiene, making sure that you don't have any visitors in your home, and if you do, to ensure that they are well without any symptoms and that they're washing their hands before touching you. So if you're remaining indoors with your loved ones and you're not going anywhere, then you know that everyone in the house is well and you have no contact with anyone who may be unwell. So in terms of your contact with your loved ones, you can go about doing all the things that you would normally do. The difficulty is that most houses will not have people who are going to stay indoors and isolate with you continuously. So again, I think you have to think about sensible precautions, that everyone who's in the house has to ensure that they're washing their hands and remembering all the contact points. So if they're touching the door handle, if they're going to the bathroom, if they're going outside. So washing their hands at all of those time points, staying away from a loved one if they have any symptoms, and trying to keep physical contact down to a minimum. Now, that's also hard if you're sharing a bed with a partner or wanting to hug a close relative. So thinking about how risky it is. So if you've got a family member that's having to work every day, the risk is going to be much higher than if you've got a family member that's just going to the shop, not touching anyone and washing their hands after they do the shopping. So in terms of visitors, based on the government advice, we're expecting the period of isolation to last for 3 to 6 months. So that's a long time without any visitors. The government advice to everyone is that we should restrict visitors to 1 or 2 people who are close family or friends. And that depends on what state you're in, because the advice is different from state to state. Our advice for cancer patients has been to be very cautious about who's coming into the house. Again, people who are visiting as well, meaning as they are, will have different contacts. Some will be working and some may be working with people who are higher risk, like me as a doctor. So wherever possible, we want you to stay in contact with family and friends, and using IT platforms like Skype to have that contact will be better. If you feel that you really want to see a family or friend member, you should make sure that you're only seeing them if they are well and have been well for the days leading up to their visit. And we usually say 48 hours, that's 2 days. And when they come into your home, making sure that they're washing their hands and staying the 1.5 metre distance away from you, so that if they are about to get symptoms, or they're coughing, or sneezing, that you reduce the chance of being a contact. So in terms of what are the things you can do to reduce your risk, really it's no different to anyone in the general population. So home isolation as much as possible, making sure to wash your hands at all the touch points, and making sure that people who are within your home or who are visiting are well and following all the recommendations. Now, the difficulties for young people are a lot of their friends and partners may still be either going to school, going to university, or working. And so you have to be really careful about what that means for your risk. And if you do have to have contact with friends and family, making sure you follow my earlier advice about reducing the distance and making sure that they're well before visiting. Patients have asked about, when they go shopping, touching things. And so we know that COVID-19 can stay on surfaces, depending on the literature, from 3 hours to 3 days. So I think, you have to be very sensible when you are buying your produce. Put it in the trolley, put it straight in the bag, wash your hands, or put alcohol wipe on your hands, and when you come home, wiping down the surfaces of jars or pouring the content into containers. And those things can hopefully reduce the risk of COVID-19 being in your household. A really important thing is every day in every cancer centre around Australia, your medical teams are meeting up to discuss the latest advice and recommendations from across Australia and across our colleagues in the world. So if you have a question, it may seem very, very simple to you, but it's causing anxiety. Reach out to your medical teams. There is nothing that you say that they will alarm them. If they don't know the answer, they'll reach out to their colleagues to get an answer. And it's really important that you feel that your questions and anxieties are listened to. In terms of strategies to reduce anxiety, I think the biggest anxiety cancer patients face is what effects it's going to have on their cancer treatment. And I think right now you can be assured that every new cancer patient who's diagnosed will be treated in a safe area. The hospitals around Australia are ensuring that the cancer patients and patients with respiratory symptoms are separated. And in many hospitals, they are screening both staff and patients as they come through the hospital doors. A lot of healthcare has moved to telehealth. So if you are not having chemotherapy or need blood products or infusions, you may be able to have a consultation at home, which reduces your risk. When you come into a hospital, the healthcare providers are very aware of the risk to patients, and if you feel that the healthcare professional has not washed their hands, it's okay to let them know that that's something that they've forgotten or missed, and to do that before they have contact with you. Okay, they may have already done it just before they enter the door and you haven't seen them. In terms of chemotherapy treatments, as long as you are well, chemotherapy will continue. There are certainly some patients who have respiratory symptoms, and before we start chemotherapy, we want to ensure that you don't have COVID-19. So we'll be doing the screening, sending you home and bringing you back to the hospital to start the treatment as soon as we know that your COVID-19 status is negative. If you do get COVID-19, I think the first thing is not to panic. What we know about adolescent and young adult patients with cancer is the chance that this is going to cause a life-threatening illness is still low, and you should contact your healthcare provider or GP and let them know about your symptoms. And if you don't have a GP and you are having any respiratory symptoms, contact the hospital, who will give you advice about what to do. If you've got what we say is acute respiratory symptoms, you're having problems with breathing, shortness of breath, you should call an ambulance and let them know that you're worried that you may have COVID-19, and they will take the precautions to safeguard you and the paramedics and ambulance staff who come and visit you. Many cancer patients during treatment spend a lot of time in isolation. So when you think about being isolated at home, one of the things you could think back to is your cancer treatment and how well you manage that period of time. That's something that not many people have experienced or want to experience, but you'll already have skills for dealing with boredom, isolation, frustration, and not knowing when the end is going to happen. And so there may be actually things that you can do to support your friends at this time, especially those friends and family members that have supported you through your own cancer treatment, because you'll already have ways in which to deal with this period.